Can pregnancy cause your teeth to fall out?
It's crazy how fast it happened.
That's today. Hello, everyone, and welcome to The Doctors. My co-host today is my good friend and colleague, board-certified OBGYN, Dr. Nita Landry. Dr. Nita, great to see you.
Always a pleasure, Dr. Orden.
You know, we have you here, OBGYN. We know there are lots of body changes and many issues that women face during pregnancy. But what about your teeth falling out after such a monumental moment? Well, it's not something we usually think of after pregnancy, but our first guest went viral on TikTok with over 14 million views after she says it happened to her. You got to take a look.
Hi, I am Alicia, the girl with the snap-in dentures. I have mini implants. They look like this. And on the top, I went in there with 13 natural teeth. They pulled them, gave me 10 mini implants, 6 on top, 4 on the bottom. Immediate, same day snap-in dentures. Took 2.5 hours.
And Alicia is joining us now via Zoom. Welcome, Alicia.
Hi.
Hi.
I can see how you got 14 million hits.
Thank you. Thank you for having me.
Tell me about your first pregnancy. What types of changes did you see in your body and your teeth?
It's crazy how fast it happened. I had a couple molars that needed root canals, and that was like the only problem I had. Nothing really, they didn't turn black. They didn't look brown until the 2 eye teeth fell out within a week apart. They didn't fall out. I'm sorry to say that because I think that confuses people. My teeth didn't just fall out. They broke out at the gum line. So you couldn't tell there was anything wrong with it. It never had a cavity to begin with. They just got super soft and weak. And when I would eat, bits of my teeth would start breaking out.
And Alicia, you made the connection with losing your teeth during your second pregnancy. And why was that?
But that was because it was so much more dramatic than the first, because I lost a lot more teeth than the first time. That was the first time that I was like, wow, like pregnancy is really hard on my body.
Why did you decide to make that infamous video taking out your snap-ins that got so much attention?
It might be really shocking to the rest of the world, but I've been trying to build a little community of people, and not even just people with dentures, not just women that lost them with pregnancy, or if it was drugs or like whatever it is. We're trying to reduce the stigma, reduce the shame, because my personal feeling is that the shame causes a lot of people not to look into the options and feel like they can't, you know, ever overcome it. And even when they do fix their teeth, like me, when I got the restoration done, I just carried a lot of shame with me, feeling like I never should have had to have that. And my teeth are fake. They're not even real. And I just wasn't so proud of them. And I should have been.
Now, I want to bring in our friend, celebrity cosmetic dentist, Dr. Bill Dorfman. Welcome to the show, Bill. Always a pleasure.
Great to see you, Drew.
Great to see you. So you've been there listening. What do you think of Alicia's story?
Well, first of all, I just want to tell you, I'm so sorry that you had to suffer like that. It's not fun. Being pregnant is hard enough, and having to go through all this with your teeth, I wish I knew you, because I would have helped you if you came to me. Also, it's not your fault. You know, some people are just genetically predisposed to lose teeth. I don't know if your parents or grandparents had problems and lost their teeth as well, but you know, a lot of people look at somebody without teeth and they always think, oh, it's drugs. It's not drugs always. You know, some people are just genetically not lucky. There's also a condition called juvenile onset periodontal disease. This is a disease that starts sometimes in your teen years. It goes into your 20s where you literally just start losing teeth. It's much more prevalent in women, and the bone that holds your teeth in just kind of melts away. Now, it doesn't affect other bones in your body, but your jawbone is prone to this, and people just lose teeth. And it's like, no matter what you do, you're going to lose your teeth. So they're not necessarily related to pregnancy, though.
And I'm glad you brought that up, because when we're thinking about pregnancy, we know that there are going to be hormonal changes that will occur throughout the body, right? And that's going to affect a woman's teeth. It's going to affect her gums. For example, when we think about the bone and the ligaments that support the teeth during pregnancy, those might temporarily loosen. And as a result, you may have more tooth mobility. However, usually a woman is not going to experience the loss of a tooth or the loss of teeth unless there are complications on top of that. So it's very important for women to see dentists to help prevent those complications that could in fact lead to tooth loss during pregnancy. But I do think in her particular case, maybe the pregnancy played a role because you do have those changes. But as you mentioned, there probably was more going on there.
Yeah, and you're right. I mean, hormones go crazy, and there's a massive increase in relaxin. We know that that loosens your ligaments. In fact, there's proof that it does to the ligaments that hold your teeth as well. Some people have even reported that they've had rapid orthodontic movement with braces during pregnancy due to that. So if your teeth start moving during pregnancy, please call your dentist. You might just need a retainer. It's rare, but it could happen.
So, Alicia, back to you. We have the expert, Dr. Bill. Any questions that you'd like to ask Dr. Dorfman?
I would like to know, is there any way to scan, to take a test to find out what your teeth health really is before you even get pregnant, or just in general?
Probably the best thing for you would have been to have had a full set of x-rays, before the pregnancy, and see what the health of your teeth were and the bone level and all that.
Okay.
And the other thing too is, just like cancer, early detection is paramount to solving a problem. If you have a little tiny cavity and we catch it on x-ray, we just fill it. If you wait a year, and now it's a root canal, a crown, or maybe even an extraction and an implant. So it's really important that you get checked right up front.
And I want to stress to viewers, I feel as though during pregnancy, a lot of patients will intentionally avoid the dentist. Well, we shouldn't do that. I think that dental care should be thought of as a very important part of your overall prenatal care. And a lot of times there is misinformation out there. So you're not sure about what you can do at the dentist's office. You can always talk to your women's health provider if you need a specific procedure, so they can help guide the dentist to say, okay, yes, she can take these medications, you should stay away from this. Or that. But according to the American College of Obstetricians and Gynecologists, as long as you shield the abdomen and the thyroid, dental x-rays are okay during pregnancy. And they also go on to say that if you need a procedure like a root canal or an extraction, or if you have cavities that need to be addressed, then you can safely do those things at any point during your pregnancy. But once again, if you have any questions at all, don't just avoid the dentist. Instead, have your women's healthcare provider talk to your dentist, and they can come up with a plan that's safe for you and your baby.
The other thing that women need to know is that the CDC has definitely determined that 60 to 75% of all pregnant women suffer from dental disease. Dental disease, well, what is that? It's typically pregnancy gingivitis. And the best thing you can do, as you said, Doc, is go to the dentist. You should go. Normally we get our teeth cleaned every 6 months, but some people during pregnancy like to go every 2 to 3 months because they are having gingivitis and they're having bleeding and all that, and it kind of scares them. The worst thing you can do when you're pregnant is to stop brushing and flossing. And a lot of people think, oh my gosh, if it's bleeding, no, don't do that, because then the bacteria and the plaques sit there and it makes it worse. And you have a new problem, decay, tooth decay. If you're not cleaning that plaque and that bacteria off of your teeth, you're going to not only have loose teeth and bleeding gums, now you're going to start getting cavities all over the place. Mm-hmm. So you really have to have meticulous oral hygiene.
Great advice. I think we have it well covered for you women out there that are pregnant or considering getting pregnant. Alicia, thank you for sharing your story, and good luck with everything. Dr. Dorfman, as always, you came ready with great information. Stay right where you are. We'll be back in a second.